hand over to Jenny Skiba from our Democratic Services team to go through housekeeping arrangements, and then we'll need to add an additional agenda item to appoint a chair, as we've got difficulty with our chair accessing the meeting.
Okay. Hi. Right. Thank you for logging on to this Zoom video conference of the Joint Health Overview and Scrutiny Committee. I am the Democratic Services Officer of Sheffield City Council for this meeting, and I'm assisted by my colleague Kate Sheldon, who is the host of the virtual meeting. We will proceed to introductions and housekeeping in a moment, but just a couple of points to note. This meeting is a public meeting, and in alignment with the new regulations which permits meetings to be held by remote means, will be live streamed for the public to view. Sheffield Live are also intending to broadcast parts of the meeting. To make the meeting run as smooth as possible, can I please ask that participants in the virtual meeting room to leave your microphone on mute when you are not speaking. When you want to speak, please raise your hand to the camera, only unmute when the chair indicates that you can speak. If at any time any member loses the ability to hear or be heard, they must alert the chair or host as soon as possible. You may see members looking to the left or right of their screens. This is because they may be looking at an additional screen or device containing the agenda papers, not because they are distracted. I will now pass back to the meeting. Thank you.
Okay, we now need to appoint a chair for the meeting. Can I ask for someone to nominate themselves and a seconder?
Councillor David Taylor, Derbyshire. I will nominate myself as chair.
And Councillor Rose Keenan, I second that nomination.
And so I'll hand over to Councillor Taylor to chair the meeting.
Thank you very much, Emily. So I hope you can all see my dark screen. I'm sorry about the dark screen. It's my bedroom. It's very dark at the moment. Anyway, first of all, apologies for absence. Do you have any apologies for absence?
Just from the chair for the time being, Councillor Mick Rooney, Sheffield City Council.
Thank you very much. Item 3, exclusion of the public and the press. Is there any items that we need to exclude the public and the press from?
No.
Thank you. Declaration of interest. Item number 4. Do any members have a declaration of declaring interest at the meeting?
Chair, Councillor Jeff Ennis, can I declare my interest as the non-executive director of the Barnsley Healthcare Federation, CIC?
Thank you very much for that. As that noted, thank you. Item number 5, minutes of the previous meeting. We've all seen the minutes. Are we happy to somebody to approve them and then second them? Well, I will say yes, so I will approve them. And I will second it, please.
I'll second them, Chair.
Thank you very much.
Are we taking matters arising?
Not on the actual agenda. Do you want to bring an item up? Do you want to bring an item up on the minutes?
Yes, please. Yeah.
I'll let you. Yeah, let you do that. I'm happy to do that.
Paragraph 536 on page 6. It mentions about the performance dashboard for the hyperacute stroke unit being suspended during COVID. I know that there's an evaluation report being published, as it says in the minutes, this month. Presumably that will be an issue that we ought to look at our next meeting, Chair, the outcome of that evaluation report.
Thank you. I'll ask officers to comment on that. They're happy with that, are they? I think.
Sorry, we'll make a note of that and factor that into the work programming process for the next meeting.
Thank you. Thank you very much for that.
I have one other matter arising, Chair, if that's okay. On page 7, paragraph 6.1, it mentions about the COVID-19 and integrated care system and the fact that we were going back to one hospital, Sheffield, Nottinghamshire, dealing with COVID patients throughout our county. Is that still the position as we find it today?
I'm looking at officers.
Helen, are you able to provide an update on that, or shall we find out outside of the meeting and update members following the meeting?
I think that would be helpful, Emily, to get the because we would need to just check in with all the partners on that.
Okay, we'll provide a response as soon as we can on that then, if that's okay, Councillor Ennis.
Thank you.
Okay, thank you very much for that. So with that, we are what do you got, the minutes are being passed, I presume. All in favour of that, are we? Nobody dissent. Okay, I can't see anybody dissent, so thank you for that. Item number 6. Now I'm going to need some help on this because obviously I'm chairing this meeting on for about 2 minutes warning, or actually less than that. Public questions and petitions. I believe that we have one public question, and I'm not quite certain how I'm going forward with this.
We've got the questioner in the gallery. Kate will bring her in, and it's Nora Everett from the South Yorkshire and Bassett Law NHS Action Group. She'll be brought into the meeting to ask the questions in a moment, Chair.
Thank you very much for that then. So we're waiting now for Nora Everett to come in. Is she there yet? Do we know? Your sound's off. Sorry. Is Nora available now or not?
I'm checking with Kate, asking if we can bring her in from the gallery. Although without the technical difficulties we've been having today, we'll have to keep our fingers crossed, I think.
We will have to keep our fingers crossed because I don't know the question, so I will need
Not
to...
them. If
Thank you. I know the question, but I can't read it. I haven't got in.
Nora's up. Nora's in now.
Lovely.
Can you hear me? I'm sorry. I don't think my videos. Oh, it is you working.
Hello, Nora.
Right. I have 2 questions actually. The first one is the planned gluten-free prescribing policy change is accepted as providing a reduced service to some people in South Yorkshire, and this is recognised in the 14Z2 assessment form. And I'm concerned why the ICS or the JCCCG are asking the meeting if there's a need to formally consult with the scrutiny on this, but because the regulations on the Local Authority Public Health and the Health and Wellbeing Board and scrutiny regulations in Statutory Instrument 218 requires that they do. But I have to add that given the terms of reference discussion, I understand the JHOSC does not have the power to be consulted with, and I recommend they do that, arrange the delegation from their constituent councils urgently so that they can use their scrutiny powers. Otherwise, why is the point of the Joint Health Scrutiny Committee if it has no statutory powers? That's the first question. Do you want me to read the second question? Is
it concerned with the same item in a way?
It is, yes. They're both about gluten.
Carry on.
It's pointing out that there's many people with an existing diagnosis of celiac disease in South Yorkshire and Bassett Law, and they're not aware of the proposed changes to the gluten-free prescribing arrangements. And also there are many people who develop gluten intolerance later in life or have gluten intolerance that has not been officially diagnosed. Are the scrutiny members completely confident that the public in South Yorkshire and Bassett Law have been appropriately informed about the proposed changes and given the opportunity to comment on the proposals? And have the the scrutiny committee members feel that the joint committee of CCGs or the ICS, I'm not quite sure who you're discussing with, have met their statutory duty for public involvement as required by the 14Z2 subsection of the Health and Social Care Act, section 26?
Thank you for those. I'm now looking towards officers and CCG members, so I don't know who's going to answer the question. So I'm looking at, thank you.
I can
Emily.
pick up a couple of bits there. On the issue of the powers of delegation and the terms of reference, it doesn't prevent us referring something. It would just need, each authority would need to go back for the power to do it. So it doesn't prevent a referral from happening. It just changes the process that happens to make that happen, and it enables individual authorities to refer issues if they want to, even if the JHOS didn't decide to do that. So that's why. Oh, I've just spotted that Councillor Rooney has rejoined.
I spotted that, so I'm quite cheerful about that. Do we want to bring Councillor Rooney back in now, because he's more knowledgeable on this than myself? I was just covering for him.
Thank you. What have I walked into?
You're on to public questions now, and Nora's asked a question. I'll now defer to your superior judgment and get out quick.
Thanks very much. What the question? Sorry.
I was just picking up a reference Nora made on the terms of reference and power to refer, and the question was about why the report is coming to the committee asking whether they should be consulted when it is a change, and therefore but I just wanted to clarify that the duty to consult with a local authority comes if something is considered to be a substantial variation. And so that's really what this discussion is about today, is that there isn't a definition of a substantial variation. And so in this kind of scenario, we would have a discussion with officers from the ICS about whether the committee does believe this to be a substantial variation, and therefore would require formal consultation.
Yeah, that's absolutely right. Unfortunately, as in many occasions, they've left it vague enough so as to put the emphasis on the decision making on someone else rather than them. So it's up to interpretation, and unfortunately, when it's open to interpretation, there will be occasions when there's appears to be inconsistency in the referral process. I'm afraid that's just always going to happen. Does that, and as I've just walked straight in, does that sort of answer the question in any way at all?
May I? The question includes the fact that they identify some areas of South Yorkshire and Bassett Law will end up with a reduced service given if the proposals go ahead.
Yeah,
and
that's right.
If that is the case, then it must be, in our view, it must be a substantial variation. If people are going to have a reduced service.
I mean, we will take that into account when we have our deliberations as to whether it is or it isn't. And you know, I can see where you're coming from, but we've heard what you said, Nora, and we will take that into account when we come to our decision at the end, plus all the other evidence that has been presented in the paperwork.
Thank you.
Okay.
There was my second question about whether the committee feel that the public, as many people aren't aware of the changes, haven't been informed of the changes, whether the public have been appropriately informed and given the opportunity to comment on the proposals, and that a lot of people have a diagnosis or an intolerance to gluten. And they're completely in the dark about this and the changes that are proposed.
Well, I think that's a legitimate question for us to pose to the officers. And the other, I think there's another factor that complicates the situation more, which is COVID, because a lot of people who perhaps would not have sought gluten-free items on prescription before will be doing so now because their incomes have gone through the floor. So I think that is a legitimate question, Nora, and I would like to tag that onto the end of that question as well.
Thank you.
Okay.
Thank you.
If I look a little bit puzzled, it's because I'm still getting over the trauma of actually getting into the meeting. I've never pressed so many buttons. I think I've blown Birmingham up, actually.
We're moving on to item 7 on the agenda now, Chair.
Right, I'm going to find that on my phone then. Okay.
It's the terms of reference report. Would you like me to introduce it briefly?
Yeah, I mean, that's a technical report, isn't it, really, more than, if you would, Emily, please.
So the report just, it was pointed out that we haven't made clear in the terms of reference that the way that this committee has been set up has been without the powers of referral delegated from each of the individual authorities. They still remain with the authorities that make up the JHOSC. It wouldn't pose a problem if we wanted to make a referral, but we just wanted to make it clear it's not a change, that's how this committee has been set up. And if you're all happy for that additional paragraph to be inserted into the terms of reference.
Yep. Well, can we have elected members' views on that? I see a simple thumbs up will be fine. We have thumbs up. Yep. Okay, Emily. That's that.
Thank you. And
we'll try to find the agenda.
Next is item 8, which is the gluten-free prescribing issue, the main agenda item.
So shall we bring the officers in and they can start talking to the report while I try and get myself into some sort of organised state? All right. Thank you. And if you could say who you are, that would be even better, because hopefully we've got lots of people watching us. Right, Idris, away you go.
Thank you, Chair. Apologies, I just inadvertently turned my camera off then rather than came off mute. My name is Idris Griffiths. I'm the Accountable Officer for Bassett Law's CCG, but I'm also the Integrated Care System Lead for medicines optimisation. And I sit on the Integrated Care System Health Executive Group, in addition to the Joint Clinical Commissioning Committee for South Yorkshire and Bassett Law. I'm actually joined by sort of Jade, Rose, and obviously Helen is here as well from a comms perspective. So Jade, do you want to introduce yourself briefly?
Please do. Is she in the room, Emily, or whoever's controlling the room?
Shall I continue, Chair?
Yeah. Okay. Maybe it's a morning for technical problems.
It seems to be the morning for technical problems, doesn't it? Yes. And I think you know, sort of Helen. Anyway.
Okay.
Present the paper then, Chair.
Please.
Can have the discussion. So just placing this into context, and obviously the consideration in terms of our approach to prescribing gluten-free products has been going on for quite some time, and not least delayed quite significantly by issues regarding COVID. But the stages we were going through were, first of all, the Joint Clinical Commissioning Committee sort of raised the question about whether we ought to review our policy across South Yorkshire and Bassett Law for prescribing gluten-free products, partly because there are different approaches for the 5 CCGs, those being the statutory organisations, obviously that have made decisions over a number of years that aren't necessarily the same, sort of some of those predating even the establishment of the Joint Clinical Commissioning Committee. So the first stage that the Joint Committee wished to carry out was an initial look at what the public's viewpoint on this matter is, and we commissioned the campaign group to carry out sort of a pre-engagement exercise to get those views. And our intention obviously then is to share this with this committee, and then sharing it with the Joint Clinical Commissioning Committee once we've heard the views of the Joint Overview and Scrutiny Committee itself. It's only then, and partly that is your views on the question that has just been raised in terms of what is a substantial variation, but also about whether the approach of standardising the policy is indeed something which would be welcomed or not. We'll then take views back to the Joint Clinical Commissioning Committee to make a decision about, first of all, whether it really wants to make a change to prescribing policies at this point in time. And if so, how to carry out any sort of further engagement or consultation with regard to that change. And only when it's gone through that stage will then it come back for a decision to be made and a further discussion with the Joint Health Overview Scrutiny Committee itself. So I don't intend to go through the detail of the papers. Hopefully people have had opportunity to read both the covering paper and the review itself. The question I suppose posing now is about those 2 points, is the committee's opinion and of any potential change and what further engagement or consultation you think would be appropriate. In doing that, hopefully the papers that you've received will be helpful in that they describe what the current differences are and what the impact potentially would be on individuals. And I think in terms of substantial variation, as you say, there's no set rule about what that measure is. We've considered, and what we've tried to put forward for information in helping inform that is, to what extent this impacts on people, how many people it was impacts on, and whether there are any concerns or issues with regard to differential impacts on individuals, certain people from different communities or backgrounds, and the equality impact. Obviously, in some cases, when substantial variation of services takes place, it's quite clear about whether public consultation would be the case. So if we were looking about citing a new walk-in centre, for example, I think that's a significant and substantial change. If it were a closure of an A&E department or a hospital, that would be a substantial change. The change on gluten-free impacts on the prescription of bread and mixers, so pastry-type mixers. Gluten-free prescribing used to be much broader than that, but there was a national review of that quite some time ago. So you used to be able to get cakes and pastries and a much wider range of gluten-free products. It is pretty much limited now to bread and mixers, so that's what we're looking at. And the majority of people, even those with celiac disease, don't actually use that prescription service for a variety of reasons. So over the population, we're looking at about 0.1% of the population who are receiving bread and mixers as part of sort of their prescriptions from their GP. Some of those are quite regular, so that they may have repeat prescriptions. Some of that 0.1% is quite irregular or may have only happened with one prescription for that year. It does vary quite considerably. So I'd like, Chair, obviously to open it out for any questions and discussion. And if there's any particular elements in the report that people would like more clarity on, more than happy to provide that as well.
Right, thank you very much. I'll take questions. Jeff's got his hand up.
Yeah, thank you, Chair. I think we can all support the principle, to Idris, yeah, I think we can all support the principle of the standardisation of prescribing across South Yorkshire Basset Law. That is not the problem. They've obviously come up with a standardised policy, which one of the consequences of that is that there's a reduction of service to some clients in some areas, and the bottom line is there's a substantial saving to the authority in terms of the bottom line. Was it the bottom line which actually determined the standardisation of this policy towards that particular angle, or were other angles looked at as well?
Thank you, Councillor. The major reduction in expenditure on gluten-free prescribing actually came about due to the national change and the restriction to just bread and mixers. I think the impact financially on each clinical commissioning group of the change, it is not the driving force for the decision. I think if you were to uplift all of the 5 CCGs to the highest level of prescribing of gluten-free, then across the system that could have a fairly significant impact in terms of expenditure. And obviously, from a commissioning perspective, if you spend on the money, the budget on one area, it's a finite budget, so you have to make the saving in another. So I think that would be sort of challenging for commissioners to afford at this point in time. And it would pose the secondary question of, well, what is it that we're going to reduce if we're going to increase the prescribing of gluten-free? So it's a bit of a mixed sort of response to that case. So in the money's not the driving force, it was really about whether standardisation was something somebody would seek. But neither do we want to expose the NHS to further expenditure, and then the difficult question of where would we make other savings.
Thanks for that, Chair.
You're welcome. Eve, and then Andrea.
So, thank you, Chair. My question is arises from your equality impact assessment at the end of your respondents' questionnaires. Just one person from a BME background replied. Can you tell me how widely that you consulted people just to get that one person? Is it only one person that uses from that background? I can't believe it. And so can you just unpack that a little bit more and let me know a little bit more about why that might be so? Thank you.
Yes, thank you, Kess. I think I share your disappointment that we didn't get more responses from people from a BAME background. The reason why that is the case is because of the representation of the various groups that were engaged as part of that discussion. So there's a little paper of the numbers and the different organisations that were approached. So it wasn't just targeted at people with celiac disease, and you're quite right, there'll be a greater proportion of people from a BAME background with celiac disease than that is demonstrated by the single respondent. Mm. The reason why there weren't as many was because they're just not represented as well as we would like in the groups that were approached. But I think Helen may be able to sort of add to that response.
Thanks, Idris. It's just really to build on what Idris has said, that this was a scoping exercise really to talk with, and you'll see in the paper, the very specific groups that we thought we ought to have preliminary conversations with in order to get a view, in order to take the issue forward. So if we go to further engagement, consultation, then we would, of course, speak with all the different groups in order to make sure that was filled back. So it's more of a preliminary exploration than it is an engagement. And again, I share Idris's disappointment that we weren't able to find more people from that community, but we would endeavour to do so further down the line.
Have you finished, Eva? Eve, sorry.
Yeah.
Andrea, please.
Thank you. I'm a local councillor in Doncaster. Obviously, at the moment, the CCG that affords the most generous level of prescribing. When I read back through the documentation on the consultation that took place in 2017, where approximately there were 8,000 respondents, some of the comments there about any reduction in the availability of products to people who have celiac disease was that there should be compensatory action taken in terms of increasing the access to dietitians and dietary advice. So can I ask, in this context, in Sheffield, did Sheffield make the choice to spend the money it was saving on the provision of foods to people with celiac disease on compensatory actions, i.e. is there more access to a dietitian in Sheffield? Thank you,
Councillor. Obviously, that decision was taken by Sheffield CCG, so I'm probably not cited as much on the detail as I'd like to be able to answer your question fully. But my understanding is that the dietetic input was improved as a consequence of that. I think there was still probably a net reduction in expenditure, but again, it was at the same time when the national consultation sort of took place and the reduction to bread and mixers as well. So quite a lot of that reduction would have taken place in expenditure anyway. So is a bit of a mixed picture there, but my understanding is there was increases in the dietetic support to people with celiac disease.
So can I ask then, if this is implemented, will you be recommending that, similar compensatory actions taken across South Yorkshire and Bassetlaw? Will we have a levelling up in regard to access to dietetics?
So that would be one of the considerations for the Joint Clinical Commissioning Committee and the individual CCGs. So we recognise that has been raised not just by yourself, but by that pre-engagement exercise. So in balancing the final decision, because we haven't made a decision about whether to change, let alone whether to consult, it's possible that the Joint Clinical Commissioning Committee will decide that it isn't the right time to make any changes. And although I think there is sort of a generally held view that we should aim to standardise, sort of the policy across the whole of South Yorkshire and Bassetlaw. Obviously, historically, the 5 CCGs have made different decisions on a whole range of issues. This is just one of those. So it's possible that the Joint Clinical Commissioning Committee would decide not to address this particular one at this time because there may be other priorities, and bearing in mind we're still in the midst of a pandemic as well. So, so when we make the final decision, we will certainly consider increasing the dietetic input into support people with celiac disease. So we'll make that consideration because it's something we've heard sort of quite loud and clear from a number of areas.
Okay, Andrea.
I've got a follow-on question, but I'm happy to wait until other people have had a chance.
No, go on, carry on. If it follows on, carry on.
Well, it kind of relates back to the situation, the sort of the equity and the fairness, because in the report from 2017, that people are cautioning that if less food is available via prescription, then there'll be a knock-on effect in terms of ill health, that more celiacs will perhaps eat foods that they're not supposed to eat, that they're not going to eat, get access to the foods that are fortified, and that there'll be a greater cost to the NHS as a consequence of that. Now, looking at this situation in Sheffield, have you gathered any data around that? Have you looked at the impact of a very restrictive approach to the provision of these foods?
I'd have to go back and ask Sheffield Clinical Commissioning Group. I think on a broader level, we're not aware that the changes in prescribing policies across the country have had any impacts on the demand for care and treatments of people with celiac disease. And again, I think I understand the genuine concerns around that, but we are talking about the prescription of bread and mixers alone, which are not naturally gluten-free, as you'll be aware. It's had the gluten extracted. There therefore remains, sort of the vast majority of people's diet is unaffected. And indeed, from a bread and mixers point of view, it could be argued that a slice of white loaf bread is not the healthiest part of someone's diet anyway. So whether it's an essential ingredient in terms of vitamins and minerals and general health, I think is a debatable one. And therefore, it does seem unlikely clinically that there would be sort of detriment as a sort of cause and effect of people with celiac disease not having access to prescription bread and mixers.
I hear what you're saying, but I'm just concerned that in that consultation in 2017, there were 8,000 respondents to that. And clearly there were enough of them who felt strongly about it, that commentary made it into the final report. And if I could just add, you know, one of my other kind of concerns as I read the documentation today is that currently we're spending nationally £15.7 million on these products. You're not spending that in Sheffield. Obviously Doncaster's, you know, up there we're spending, but I find it, you know, I'm somewhat concerned that we seem to be advocating for a move to spending nothing across the whole of South Yorkshire and Bassetlaw when nationally we're spending 15.7 million. So clearly other parts of the country are seeing the need to spend in this way. Thank you.
Yeah, it's a very mixed picture across the country. I think that probably Doncaster has one of the most generous, if I put it that way, prescription policies on gluten-free products in the country. Many CCGs have taken the approach to Sheffield. And again, I think the concerns are absolutely genuine, and I understand those. Like just plain, there are alternative ways of looking at this, and like I say, I don't think that bread and mixers are the core healthiest part of someone's diet, and gluten-free products obviously are much more widely available than they were in the 1960s when prescription of gluten-free first commenced. I think the other thing is that we haven't. Obviously, one of the options is to go to the Sheffield model, and that may be the one that's sort of considered more fully, but that decision hasn't been made yet. So we're not making a recommendation yet to the Joint Clinical Commission Committee that should be the approach. It's just one of the options, and it's one of the options that we wanted the views both of yourselves and the people that we engaged in the pre-engagement exercise. And I think there are some common themes that are coming out, both in terms of some of the comments I've heard this morning, but also from that pre-engagement exercise, in that there are genuine concerns about the impact on certain communities, and that the idea of standardisation is generally, I think, welcomed, but a concern about what implications that might have for certain groups.
I mean, standardisation doesn't have to mean downwards. It could mean the opposite. It could mean towards the middle, or it could mean towards the top. So I'm a little concerned that there appears to be an assumption in this conversation that we're talking about standardisation down. I mean, as a politician, as a socialist politician, that goes against the grain. So, you know, I'm not really happy about that. I just wanted to ask about children. Where are we with children, with feed and that sort of thing? You know, because there are children who are allergic to celiac. So what are the proposals for children in this if we go to like zero prescription?
So again, we've not fixed on a single proposal, and as you say, Chair, you know, so there's a presumption that we're talking about going to the Sheffield model for everybody. I think that's probably just one step further than we are currently. We're still considering options, and how we deal with children and potentially other groups as well. You know, sort of the poorest in our society are options. So we could consider the option of continuing to allow prescriptions of bread and mixers for children. I think for very young children, because you mentioned about fortified food or sort of other, you know,
yeah, bottle-fed children.
Yeah. So if children are receiving fortified food for more generally because of their conditions, and obviously that can go beyond children, then that wouldn't be covered. So the fortified food, the SIP feeds, the you know, sort of that type of food, because that would be a more general sort of health issue in terms of sort of weight loss and child development and healthy development. Like I said, the the prescriptions that we're talking about here are basically bread and mixers.
Right. This survey, this exercise took place in 2017. Was that right? Because I haven't got the paperwork. This phone's not working now. So when the figures that you quoted in terms of participation, and when are they from? Are they pre-COVID?
They are pre-COVID, and Helen will be able to give you, I think, sort of more precise sort of response to that.
Thank you, Idris. Just to confirm, Councillor Rooney, that the national consultation that we refer to in today's paper was 2017,
yeah,
and the local exercise where we engaged with the different groups, the targeted groups, was last year, so 2019.
right.
We haven't done any consultation or engagement during the COVID period, so this would have all been pre COVID-19.
See, the reason I'm asking is that you know, people who ordinarily would not use the prescription route for gluten-free products may well be doing so now because of the state of the economy. Many of whom, they may be furloughed, they may have lost their job, etc., etc. So it's the figures, and I am concerned that I think on 2 or 3 occasions, there's the fact that there's only such few people affected by a change is almost being used as a reason to change in itself. And I can understand that up to a point, but if it's you, it's 100%, you know, and that's where I'm coming from in that situation. I don't want to get into a numbers game. My thoughts are simply about being fair to everybody and equalising the system, whatever way that might be. And I think I probably already said I don't want it to be equalised down. So I just wonder what your thoughts are on that.
I think you're absolutely right that numbers isn't the be all and end all. I think it's important to consider it. Obviously, if you were closing a hospital, potentially that would impact on every single member of society, and therefore, you know, it would be substantial, wouldn't it? You know, so with I think much argument. I think the two things go hand in hand. So the level of impact on an individual and the number of individuals it impacts. So if the impact is significant on everybody, then that's incredibly substantial. At the other end, if the impact is relatively small and it's relatively few people, then that's the other end of the scale, is the only sort of observation. I think then there's a judgment about, well, how big an impact is not prescribing as much bread and mixers to an individual. I'm just sort of putting out the numbers there that in terms of the volume of people, the number of people, it's 0.1% of the population. In terms of the impact on each individual, it would be receiving less bread and mixers, whether that be a lower amount or it was stopped at all. You know, that's the sort of the impact.
Okay. Are there any other, Andrea?
Yeah, just picking up on that point about bread and mixers, I noted in the consultation from 2017, people were commenting that the mixers available through the NHS are fortified with additional minerals and vitamins in a way that the ones commercially available in the supermarket aren't. And they felt, some respondents to that consultation felt that that was really crucial, the quality in terms of diet. Could you just comment on that, please?
So I think it is important to recognise that the mixers are fortified. I'm not sure whether it's completely accurate to say that you can't get fortified mixers in other areas, or indeed sort of add supplements to food. I think I think it is important to acknowledge that they are fortified. But it comes back to my previous point that actually most of an individual's diet in terms of vitamins, mineral and general health comes not from a fortified mix or a fortified bread, it comes from the whole range of the diet. So yes, it's important that they're fortified and to recognise it. It would be wrong to say that that's the only source of healthy food, vitamins and minerals for an individual.
Yeah, I think
minor source in fact.
Feel as I'm hearing you say that, I can recognise the truth of that for people who, you know, can afford to eat a really good range of foods and can afford to shop for fresh fruit and vegetables, etc. But, you know, we all know that for people on very low incomes, carbohydrate forms a bigger part of their diet because they, you know, they can't afford lovely fresh fish, meat, fruit and vegetables. And I just feel that we need to take that into account.
Okay.
Yeah, I don't disagree, Councillor, that that's one of the issues I think we need to carefully consider, is those who are poorest in society, what the impact on them would be. And it's clearly the case that it's more likely that there would be an impact on them than those that can afford, and probably already do, just by, you know, sort of straight from the shelf. And obviously, in terms of health inequalities, it's a more general concern that we have as well, because here we're only talking people with celiac disease. Obviously, the problem that you're describing goes much, much broader than that in terms of access to sort of healthy food and healthy diet for the poorest in society.
It does, but the point's made multiple times in that consultation that if you go to a food bank, you can't obtain gluten-free products.
Yep.
May I just venture with one further question? Oh.
You may.
Thank you. Going back to the famed consultation from 2017, there were three kind of special issues that were highlighted around moving away from prescription items. That was low income, limited mobility, and living in a rural area. And I just wondered, you know, when I think about Doncaster, you know, there are lots and lots of small rural communities, and I'm sure, you know, I realise it's very low incidence, but there will be people in those communities who perhaps find it more difficult to access the high quality gluten-free products that the you know, the large supermarkets would stock. So would that make it reasonable for Doncaster to justify its different approach? I mean, when Doncaster came up with its different approach, was that the kind of thing it was founded on?
So I think I'm sure that was one of the many things that would have been taken into account, and certainly as the accountable officer for Bassetlaw, much of which is a very rural community, it has been the sort of thing that's been considered as well. I think every year that goes by, access to gluten-free products is improving. So I think if we went back 3 years, back to that national consultation, I think access would have been a lot less than it is now. But I think you're more likely to have difficulty with access in very small rural communities. Indeed, in many of those smaller rural communities, there isn't even a shop, sort of let alone one that's gluten-free. But I do think that the access generally, whether it be through internet shopping or even local petrol stations that sell, you know, sort of products and things, the one nearest to me, I live in a rural community, has a whole shelf of gluten-free, and they certainly didn't have that a couple of years ago. It is an issue, it is a concern. It's probably reducing, but it's still there for some. And again, if we move down this route, one of the things that we'll have to consider is, do we make exceptions, and in what cases do we make exceptions if we were to more generally reduce access to prescriptions for bread and mixes?
Alan, you wanted to add something, I believe. I'm looking at the time. We are scheduled until 1 o'clock. I don't know if we've got any leeway on that, Emily, at all.
It shouldn't be a problem technically. I think it depends on participants' availability.
Okay, right. So we're talking probably 1 o'clock, 5 past to finish. Okay. Helen, sorry.
Thank you, Councillor Rooney. It was really just to support what I think members are saying today, that the findings themselves in the engagement exercise that we carried out across South Yorkshire and Bassetlaw, one of the things that people did say and came across in the themes was that they would like to see support measures in place for people who are vulnerable and in need. And so that would very much form a part of the recommendations into the joint committee in terms of things it would need to consider. So just to reassure members that that is absolutely a part of the what people have told us already is part of that pre-engagement exercise.
Okay. Are there any other questions from members? I'm getting no. Idris, could you just, so that I'm clear about what we're being asked of, because it's a little bit on the vague side, which is, I suppose, helpful but not helpful, if you know what I mean.
Yes.
If you wouldn't mind, please.
Yeah. So I think the two questions. One was to hear your views, which I think it's been really helpful discussion to hear the issues that you think need to be sort of taken into account and considered, and which ones most seriously. So if I play some of that briefly back, if that's helpful, Chad, because
yep.
If I summarise this correctly, then that's what I can take away. Yes.
I'll let you know.
So first of all, I've heard from the meeting that standardisation is potentially a positive thing. Standardising up is easier and would be more welcome than standardising down, but there are options to standardise somewhere in the middle as well. So we shouldn't just be talking about, yeah, it's all or nothing. And if the prescriptions were more limited for certain areas, your particular concerns would be about the impact on the most vulnerable, whether they be children, those living in rural communities or isolated, or those with the sort of the lowest income, if at all. So those I'm taking away as the sort of key points that you feel that we ought to be considering and taking into account. I think the second question for you is the vexed question of, do you feel that engagement is appropriate, or do you feel it's such a substantial change that we ought to be considering formal consultation?
Does if we were to say engagement now, formal consultation as a possibility after the engagement, is that feasible? Can you do that?
In theory, Chair, yes, we could. And my reticence is that I think that's partly what we've tried to do already in the pre-engagement and the paper that we've presented. I suspect that hearing the conversation in this meeting and that pre-engagement exercise, there are common themes coming out. And I suspect we're not going to get new issues that haven't already been raised. So I could be wrong, but I suspect that that's the case. Of course, as we had the question at the beginning, whether this is, we haven't done a comprehensive consultation exercise. I'm suggesting that we have. And that would obviously give greater opportunity for people's views to be sort of collected. But there is a proportionality thing that we'll need to consider as a joint clinical commissioning committee, because if we have to go through formal consultation, which is quite an extended period of time, for something particularly at this point in time, you know, so that would be in itself something for us to consider.
Okay. Just one last thing. The results of either of those two processes would come back here for us to make a judgment on, yes?
Yes, that would be my view, Chair.
Okay. Okay. Helen?
It was just to reflect that the consultation ask at this stage is with yourselves rather than the public. That's where our duty lies. It's, do you want us to consult with the JOSC on this issue? And I think we would probably do some more engagement anyway, given we have spoken to 88 people. We have targeted those conversations, but we haven't raised awareness that there might be some changes to how people would access gluten-free bread and mixes. So I would be recommending that we did some further engagement on this as well.
Okay. Can I ask then if we could just the politicians could have 5 minutes or so on their own, if we could take the officers out of the room and just have a political discussion, Emily, don't leave me, because I want you to stay and Jenny to stay, but the other officers to leave and just have a conversation with the politicians. Yeah.
Okay, just a reminder that we're live streaming those, so we're being broadcast
Well,
in
how
a
does
public
that?
meeting. Are you wanting to go into private session?
Now there's the thing. Advice, please.
Can
Chair,
I
we'll
ask-
be able to stop live streaming to take people out and put you in a private room. We won't be able to do that in this
Right.
webinar.
Okay.
Can I throw another
Grenade, brick.
I do have another meeting, unfortunately, at 1
Okay.
One option that you may want to consider is,
Okay.
I'd be very happy to receive the committee's views after the meeting. And so there's an opportunity perhaps there for you to have a bit of further deliberation.
In the interest of being open and transparent, we'll have the discussion now, unless elected members have got any particular objection to that. No, they're happy for us to do that. Well, okay. Other than me, can somebody speak on what their preferred option is, which I believe is either further engagement or formal consultation? Is that correct, Idris? Yeah. Jeff, you look as though you're ready to speak.
Well, I think given the assurance we've been given by Idris, I think we can go to the next phase without going through the formal consultation process at this point in time.
David, you raised your hand.
Yeah, I'm happy. I don't think we should go into the formal. I think we can engage with him as we're doing. I don't think formal it's going to put things backwards at the moment. So,
and it's costly and it's lengthy, isn't it?
Exactly.
Andrea?
I'm happy to support the view of colleagues.
Eve, have you a view?
Yes, I still have some reservations about the equality impact assessment, and various members of the community are being kind of absent, if you like, and I'd like some assurances that there will be a better engagement this next time.
Could you correspond with each other? I don't know whether with you personally, Idris, but if someone could liaise with Eve and listen to her views and perhaps alter the manner in which we're consulting with certain sections of society, I think that would be helpful. Yeah, could you do that?
Yes, happy with that, Chair. And just to reassure all members, if we decide to proceed with this without formal consultation, we will be carrying out further engagements.
Yeah, and you will be coming back here.
The points that Councillor Eade has just raised are addressed as part of that wider engagement.
And you will be coming back here, yes?
Yeah.
Well, in that case, I'm quite happy to make it 5 out of 5 unanimous further engagement. Okay. So that Emily.
I was just wondering, Chair, if it would be helpful if I just kind of summarised for the minutes, so we know, so we're clear about where we are on each of those points.
Yeah,
very briefly.
Yeah,
so,
if you wouldn't mind.
So if we're saying that the committee asks that the issues it's raised during this meeting are fed back to the JCCCG, as summarised by Idris earlier, that the committee doesn't consider this to be a substantial variation and doesn't require formal consultation, but would like to be kept updated on progress and would welcome further engagement on the issue. Does that feel about right to people?
You're getting nods all around, Emily.
Great.
Okay. I think that's the end of that item. And I'm guessing from memory, I think the only other item is next meeting, is it? Is that right? Because I can't get my phone to work now. I've got the laptop to work and my phone's died on me. Oh dear, I think I'm gonna. Any cat lovers out there? I'm gonna kick out a cat. Right, Emily, when is it? When are we having?
We haven't got anything scheduled yet. I think we've tended to have them roughly quarterly. I'm looking at Helen would kind of early in the new year work for the for scheduling something, and we'll liaise and get an agenda and a meeting set up if that suits everybody.
Yeah, I think it looks as though it does. Thank you for your attendance this morning. May I be the first to wish you all a very happy Christmas and a safe journey home. Thank you.
Take care. Bye-bye.
Bye.
Thank you.